everyone. Good morning, switching into good afternoon. I hope everyone has having a good Friday so far. I'm Liz Flannery. I'm the Director of Education and Leadership here at AIDPH, and we're thrilled to be with you all here today. Thank you for taking time out of your day to join us. Thank you for letting us meet with you and talk about veteran oral health in Mississippi. We're really excited to go ahead and get started. So we are going to do a couple of things in this session here today. I will start by saying we design these sessions to be very interactive. We will have some structured ways to hear from all of you, but we invite your comments, your feedback, your conversation. So please be thinking of your questions as well as additional pieces that you're seeing in your work that you want to contribute to this conversation. We will start by looking at a national overview of veteran oral health. What is eligibility and access? What is the state of veteran oral health? And then we will dive into the specifics with the Mississippi state profile and look at what things look like in your state. Again, we want to hear from you throughout. We're going to talk about how we'll do that, or one of the ways that we'll do that in just a minute. And we are going to leave with action items and next steps because we don't just want to talk about the issue of veteran oral health. We want to make sure that we leave feeling activated and like we know a path forward.
And Miss Liz, I'm sorry, if you don't mind if I could just interrupt you for 1 second.
Sure.
We are, as a representative of MOCA, which is the Mississippi Oral Health Community Alliance, we would like for everyone who has Zoomed in to sign in for us. So if you will, just open your chat box and type your name, your email address, and we're also going to give everyone who Zooms in a gift card for just coming and participating and being a part of this seminar. So the choices are Walmart, Starbucks, or Subway. So make sure you also include that information when you sign in. So that's your name, your email address, and the gift card of your choice, which is Walmart, Subway, or Starbucks. Okay. And you can continue, Miss Liz.
Okay, thank you.
You're welcome.
So we're going through a few housekeeping pieces. We are recording this session. We will be posting materials from this session, the slides, the forms, materials to our academy afterwards. The recording and the information will be available asynchronously. Again, we want this to be very interactive, and we want to make sure that we're providing space for you to connect with your colleagues and fellow stakeholders in veteran oral health and public health in your state. So please, as Dr. Monica Mocha just said, please
Dr. Johnson.
Dr. Johnson, I'm so
Yes,
sorry.
ma'am. That's okay.
I got a little tripped up with your Zoom name there.
It's okay.
Please take a moment and type your name, email, and organization in the chat. And just a little clarity, providing AIDPH is hosting this webinar. The gift card piece is through MOCA, so I direct any questions about that to Dr. Johnson. Sheila Stewart, my colleague, is joining us here from AIDPH. She will be helping us with our conversation, monitoring the chat for us, but also if you have any questions about Zoom or other pieces, please feel free to send her a direct message via Zoom. Okay. So here's one of the ways we are going to get started with engaging. We will be using Slido.com for part of our engagement today. If you haven't used Slido.com before, it's pretty straightforward. You can scan this QR code with your phone, or you can type in this website as well as this code, which Shayla is also going to pop in the chat, and it will take you right to our polls and engagement pieces there. Once you've pulled that up, please leave it up. We will be using it throughout the seminar. The other piece too is as folks come on, as part of our engagement, if you are able, we invite you to be on camera. That helps us engage in conversation and be here together in community. Whoops, I'm so sorry. I'm so sorry. One of the joys of working from home is having our furry friends with us, and there is a very loud vehicle going by my home office right now, which disturbed my pups. I apologize. Okay, these are our learning objectives for today's sessions. These are attached to our CEU that is available for today's session. We will include information on how you can request your CEU after participating in the full session at the end. These learning objectives were available in the registration materials and are also posted on our Academy. And for those of you watching this asynchronously to earn your CEU, these are available in Academy with you as well. Okay. So let's get warmed up with Slido, which is again how we're going to engage together today. So if you want to toggle over to that website that you opened up just a bit ago, pull that up. Again, it's in the chat if you want to go there. I'll pull this over. We want to hear from you. What brought you here today? Are you here to learn, to share, to connect, or to act? Or maybe it's all four of those. So I see mostly all of the above. That's fantastic. Connection. I hope we're getting started with that in the chat. I'm seeing some folks introducing themselves there. Learning. Okay, so you'll have to let me know as when we get to the end here, if you felt like you've learned something. We will have questions for you of how you're feeling ready to act. Okay. I really see all of the above in learning as our winners here. I'm going to toggle us back to our slides, but if you have not had a chance to respond to the poll, please continue to do so. This is important information for us to capture. Okay, great. Okay, I am your presenter for our session here today, and we are just sharing that I do not have any disclosures to share. As I said earlier, I am the Director of Education and Leadership here at AIDPH. I am involved in our veteran oral health research and our advocacy. I also happen to be the spouse of an active duty service member. And so in my personal life, working with veteran communities through volunteer work is something that I do and I'm deeply passionate about. So this is work and a topic that I am excited about both personally and professionally. And again, thank you for being here today to talk about it. I also introduced Shayla Stewart, and we wanted to give a big thank you to Dr. Johnson from Mississippi Oral Health Coalition Alliance for bringing all of you here today. It's been a resounding success on getting the word out and getting registration numbers for this session. So thank you for being such a champion, Dr. Johnson. And I think
You're more than welcome.
to give an introduction. You had wanted to give an introduction piece here? Or was
Actually, you kind of already did that.
Okay.
Yeah, so you can just continue.
Okay. All right. Well, a big thank you again, and thank you all for being here today. Okay, so we're going to go back to Slido again. And as we're getting started, we want to know, what do you believe are the top priority areas for veteran oral health in your state? And this will just help me make sure that I'm tailoring our content here today. Go back to Slido. Okay, so we have integration with general care, policy advocacy, workforce development, access to care and oral health literacy. Okay. If folks have comments on the oral health literacy piece, I would love to hear those in the chat. As you can imagine, that comes up quite a bit. And we'll talk a little bit about understanding oral health outcomes for veterans and kind of the knowledge around that. So if you have thoughts on oral health literacy around patients themselves, veterans themselves, or it might even be the clinicians or the administrators and kind of those outcome pieces. If you have comments on that, I'd love to hear about that. Integration with general healthcare, we're going to talk about that quite a bit. And access to care is really our overarching topic. Okay, as we go back to our slides, please continue to respond if you haven't done so already. Okay. So a little bit about AIDPH and why we are here having this conversation today. We are a 501(c)(3) nonprofit, and our mission is to empower our community to advance oral health through science, education, and advocacy. You will see the convergence of those three activities throughout our talk here today. The foundation of what we're talking about is the research that we have done across several communities, but particularly veterans, bringing it into an educational programming and talking about one of the action items that we'll have and the ways that we can use this data to move forward is through advocacy efforts. We do this work because we have a vision of a justice-oriented oral health system. We have 4 communities of focus at AIDPH. It includes LGBTQIA+ people, veterans, which obviously we're talking about here today, people with disabilities, and rural communities. Understanding, of course, that there is intersectionality on these 4 communities of focus. For example, what we're talking about here today, approximately 30% of veterans report having a disability, and approximately 25% of veterans live in rural areas, something that we're going to talk about quite a bit more as we dive into the data today. And we can look at how kind of those intersecting pieces really increase disparities. All of our communities of focus have the common experience of historical exclusion and marginalization from healthcare systems. We want to take a moment and say thank you to our funder, which is CareQuest Institute for Oral Health, for funding this programming and allowing us to be here today. This is a snapshot of the work that we have done in partnership with CareQuest, specific on veteran oral health, really looking at the landscape and understanding that we did not have information on what veteran oral health looked like, and really understanding that there were some serious data gaps, and we needed to kind of understand the population health for veterans and look into that more. It started with surveys in a community engaged manner, working directly with veteran service organizations. It is very important, and part of how AIDPH works at the core is always to conduct our research and our programming in a community engaged manner and working with the populations themselves, so that we are leading from behind and raising our community's voice. Along the way of doing this research and publishing several different pieces, we've also had the opportunity and the privilege to lead and go to several Hill Days, to publish research briefs, to do this series here today where we can talk to local stakeholders and really serve as a community champion for veteran oral health. Okay, so again, we're going to get started with a national overview. So this might be familiar to some of you, but what we found in doing this work for many years is that most people don't understand the eligibility process, what care veterans can receive, or even where and how they can access the care. So that's really why we like to begin by setting the stage with a clear picture of what's currently available through the VA, how eligibility is determined, and what veteran oral health looks like at the national level. And to kind of set that stage over the next 2 slides, I'm going to cover 2 main points. The first one being is that eligibility for medical and dental care through the VA is not set by the VA itself. It's determined by Congress through a federal law called Title 38. And that law outlines what care is covered, who qualifies, how much it costs, and where it can be delivered. Because of that, any major change, like expanding dental coverage, requires congressional action. It's not just a policy or a rule update. It involves passing new legislation at the federal level and then securing federal funding to support it. So when we talk about the limitations in access to dental care for veterans through the VA throughout the course of this seminar, it all ties back to laws at that federal level. At the same time, I want to point out that that doesn't mean we can't take action and impact change at the local and the state levels. The first step in that is getting educated, which is what everyone here is doing today. And then really looking at collaboration with our local communities and how we can advance oral health. We'll look at some specific state legislation pieces that give strong examples of how states can make change at their local level to increase access. Shayla, I see you're off mute.
Someone was just having some audio issues. I just wanted to make sure everyone could hear us, but I think it's resolved.
Okay, great. Can you hear me okay, Shayla?
Yes, I can.
Okay. I'm also doing a quick, my screen's being a little funny on my end, so I was just doing a quick check to make sure y'all could see it okay. Okay. So the second point in looking at the state of veteran oral health care across the country is that most veterans are not eligible for dental care through the VA. And unfortunately, we find that's an unfortunate fact. And we also find that that is very surprising to folks. So if we look at this graphic here, that row of people you see represents all 18 million veterans living in the US today. The lighter colored half over to the right shows that veterans who either receive care outside of the VA or aren't eligible for VA healthcare at all. And as you move to the left of the chart, that darker blue section represents the nearly 9 million veterans enrolled in the VA healthcare. Then you will see that very dark blue and red section all the way over to the left. That tiny fraction is what actually represents who is eligible for dental care through the VA. So what that means in practice is that veterans might go to the VA for medical appointment, get treatment for a chronic condition, but still leave with untreated dental pain or dental disease because they're not eligible for dental care through the VA. The other part here to point out is even among that 1.8 million veterans who are eligible for dental care, only about a third of them are actually using those benefits. So we need information to understand that low utilization rate a little bit better, but we suspect that barriers to care and lack of awareness play a big role in that utilization rate. And we'll see as we look at the data, we'll kind of see some pieces that could be causing those barriers to care. So ultimately, we're left with a deeply inequitable system. Veterans either aren't eligible or they face a fragmented oral health landscape that makes it hard to get consistent, high quality care. And as we know, that problem can be even worse for veterans living with chronic conditions. And we're going to look at that a little bit more and look at that systemic connection piece. And I thank you for bearing with me for a second. I'm just doing a tiny screen adjustment here. It's giving me a little bit of trouble on my end. Okay. So veterans living with chronic conditions like heart disease and diabetes are especially vulnerable to oral health issues. I think this is probably very, very familiar to most of you, this chronic conditions and systemic health connection with oral health. What's even more concerning is that veterans with these high risk, high cost conditions are more likely to lose all of their permanent teeth. And we see poorer oral health outcomes for veterans than non-veterans, even when they've seen a dentist in the past year. So that tells us that access alone is not solving the problem. Even when veterans are getting dental care, many are still facing some of the worst oral health outcomes. And a big reason for that is the lack of the integrated care. So that came up at the beginning of our call, right? Looking at that integrated care piece. And that really could be a solution to these poor oral health outcomes for this population. These chronic conditions aren't being addressed in coordination with oral health needs. And when we look at it, the VA is the largest integrated healthcare system in our country. It's uniquely positioned to manage complex care for veterans with multiple chronic conditions. And that's why it's so key for that access to the dental care piece to be expanded. Since most veterans aren't eligible for that dental care through the VA, they're missing out on that really critical coordinated care piece, leaving major gaps in their overall health outcomes. We're going to look at this a little more specifically. This comes from recent research that we've conducted again in partnership with CareQuest. It really focuses on the connection between chronic disease and oral health. So even after controlling for factors like income, education, and whether someone lives in a rural area, we found that veterans with diabetes were still 40% more likely to be edentulous, meaning they've lost all of their natural teeth, compared to veterans without diabetes. That's a really powerful indicator of just how strongly chronic disease can impact oral health outcomes, even when other risk factors are taken into account. So just as concerning are the findings related for heart disease. Veterans with heart disease were 30% more likely to be completely edentulous compared to veterans without heart disease. Okay, so let's talk about this for a minute, looking at the systems level piece of this. What we want to highlight is that this isn't just about poor oral health outcomes or reduced quality of life. Those are obviously very serious concerns. It's also about the broader health impact and the cost of care. When dental care is managed as part of an integrated healthcare system, like what the VA could offer if dental care coverage was expanded, there's a clear opportunity for cost savings, especially for veterans with chronic conditions. Some of our recent research shows that for every $1 invested in dental care as part of diabetes management, there's a $1 savings in related medical costs. And with heart disease, it's more striking. For every $1 spent on preventative oral health care, it can result in $2 saved in heart disease management. So at that point, dental care isn't just a health benefit, it's really paying for itself. And I just want to note here that this is important context to keep in mind as we look at chronic disease trends in Mississippi and consider what solutions might look like there when we dive into the state data. Okay, these are data points collected through research from AIDPH and CareQuest. They come from BRFIS, which, as many of you know, is a national survey, and from data accessed through the VA. Again, highlighting some of these pieces on urban versus rural veterans. I'm sharing a quote here that comes from some of our qualitative data that we've done through our different analyses, really highlighting here how important it is to connect the human voice and first person experience to the data that we were looking at. This is from a working age veteran living in Maryland, and we'll see here really the impact of these poor oral health outcomes and that this person just is not able to get the care they need and they're asking for help. Okay, this is a screenshot of some of the interactive dashboards that we have available on vetdentaldata.org. Sheila's going to pop that in the chat for us. So when we're talking about the research here today, I've mentioned a few times we have several publications on veteran oral health. In just a few minutes here, we're going to look specifically at Mississippi State Profile. All of that is housed as a compendium of work on veteran oral health on vetdentaldata.org. In addition to publications and the state profiles, we have interactive dashboards. So you can really dial into data that's specific to your work, to your program work, the area that you're working in, and dial into this a bit more to fit your needs. So just sharing some screenshots here and what you can do with these dashboards. So we have an entire tab dedicated to rural veterans. Again, we will look at that piece for Mississippi, but we know in general across the country, veterans disproportionately live in rural areas. And that's why we're talking about that rurality piece so much. So we use MEPS, which is Medical Expenditure Panel Survey. And while the data aren't available from MEPS on a state level, they can be evaluated by regions. You can get a sort of proxy for state level data when you're using this piece here. This is another look at the dashboards. When you click on the rural tab, it will take you to the interactive dashboard on rural veterans. And across each indicator, it's clear to see that rural veterans delay dental care due to cost, spend more out of pocket on dental care, and struggle to find accessible locations for dental care. Okay. Rural veterans also feel more impact from lack of access and utilization to dental care, often citing that the state of their mouth or teeth is embarrassing compared to non-rural veterans. Looking back at that quote we shared a few slides back. Rural veterans also struggle more with a functional dentition, and that likely leads to the data points that we see around increased cost of care and higher emergency department use. This is showing us some of our publications that are available on vetdentaldata.org. And just noting here, this is a snapshot of the research and the tools that we've developed to help folks like you doing the work at the local level. We want you to be able to access clear, tangible data about veterans. That information can be really tough to find. And that's why we've worked in partnership mostly with CareQuest, worked closely with veterans and veteran partners and pulled in every available data point we could from the VA, national surveillance systems, and more. We've pulled it all together here in one place to hopefully make it as easy as possible for you to use and apply this information in the work that you do. Again, that's why we're hosting our tour here from today. And if there's something that you're not seeing or have a question, or there is a tool that occurs to you that would be more useful to you, we're going to ask some specific questions around that. But again, invite you to share that in the chat. We want to make sure that our work is serving you. Okay. Again, these are some additional pieces. We are going to head into your state profile in just a moment here. If you have not already taken a look at your state profile, and I invite you to go to vetdentaldata.org and pull up the Mississippi profile, and you can go along with it as we talk about it. You can do that by going to publications and putting in Mississippi. You can hover over Mississippi on the interactive map. Either of those ways will bring you to the state profile. Okay. Before we jump into that state profile, we would love for you to toggle back to Slido again and share in one word, naming what you think your state's biggest challenge is for veteran oral health. Reliability, access, information, funding, location, collaboration. I'm curious about that reliability piece. I'd love to hear more about that. Shayla?
Yes, we have a few people in the chat. Transportation, oral health literacy, which I wholeheartedly agree with, funding, trust, access. Those are the main ones.
Okay. Insurance, access, coordination. Okay, great. These are great conversation starters, and I think we'll really see these reflected. So insurance access, that means several people are double tapping on that one and plugging that in. Lack of appointments. Okay. All right, great. None of these are great, but this is a great start of insight, and I can see us having a really robust conversation. Okay. I'm headed back to the slides, but if you have not yet answered, please continue to do so. Okay. So what do the oral health profiles look like, specifically in Mississippi? We put these state profiles together to answer a question that we were getting frequently. I said at the top of this call, we are a nonprofit. We are a small nonprofit. We are all virtual. We are geographically dispersed. And as such, we are a small and mighty team, but we typically are working at the national level and looking at pieces from a national overview. But as we dove deeper into our work in veteran oral health, we were regularly getting the question, what does veteran oral health look like in my state? And that was really our call to action to put together these profiles. The other piece I want to point out is when we put these profiles together, obviously our research team conducted the analysis, but they worked very closely with our communications team to put them together in a very graphically pleasing, easy to understand way so that it was an easy tool to folks to just download and use in their work, use in their reporting, use in their discussions with stakeholders, so that they were able to bring this information forward to lay people and decision makers in their state. Okay. So when we look at the state profile, we open each profile with some quick context. And that's what's happening in Mississippi and how it fits into the bigger picture nationally, especially when it comes to dental care access through the VA. So we made the key point at the beginning of the call, and we start these profiles with the same key point, is that most veterans are not eligible for dental care through the VA. And that, again, because that's something that most folks don't understand, is a really powerful place to start the conversation. So again, because the gap at that federal level, it's states and local healthcare systems that end up carrying the weight, whether it's disease burden, access issues, or care delivery challenges. So it can be a really powerful place to start the conversation with decision makers in your state. We've also included data on where veterans live across Mississippi. So this map here with this chart really shows you those percentages so you can get a full state snapshot. And then these counties here have the highest veteran population. So that can kind of really give you some specific information. I saw transportation come up on that word cloud. I think I saw a few other location pieces. I'm wondering if it's still up. So when we're looking at these, lack of appointments, lack of reliability, I think looking at the location of veterans in our state compared to where the VA clinics are, and then VA clinics with dental care, because not all of them have dental clinics, can really give us some dialed in insight to those pieces. Okay. So right up front, we hope that this gives you useful county level insight to support better informed local decisions about how to deliver care and improve access. So then we compare Mississippi to national averages, because without that context, the numbers don't mean much, right? So if you're sharing this with a program manager, a decision maker, a board member, they might not know. Is 15% high? Is it low? Is it somewhere in between? So including these national averages here help you quickly see where Mississippi stands. You can also compare across states if that's helpful. So you can pull up the full profile to other states, specifically ones that you feel maybe have a similar demographics, have similar political environments, a similar health system. That might be helpful for you to compare there. We'll also share in a minute how you can kind of do a quick analysis of what states might be helpful to compare to with an interactive map. Okay. So earlier I mentioned chronic diseases and those high cost, high risk conditions like heart disease and diabetes that are closely connected to oral health. And because those connections came through strongly in our research, we wanted to make it easy for you to highlight them when you're talking with decision makers or planning programs. So in this section, you'll find data on heart disease, diabetes, insurance status, and indenturism, all compared to those national figures. And then we also ranked each state across those 4 key outcomes. So you'll see where Mississippi falls compared to all 50 states. So, and just a heads up, if you look at these rankings, they're assigned from worst is number 1 and best is 51. So these low numbers are our areas for improvement here. Okay. Also, just noting, if you are interested in how we did our rankings and want to look at those technical details, that full methodology is posted with the profiles on our website. Okay, and then we get into the grade portion of the profiles. We see the grades individually given for diabetes, rates of uninsured, and dental visits. The percentage of veterans in Mississippi that visited a dentist in the past year, and then those combined for an overall grade. So looking at this portion here enables us to take a look and see where our areas of improvement are. Another strategy with this piece, we chose this approach because everyone or most everyone has gotten a report card in their lifetime. And so we wanted this to be a really impactful visual tool that you can take to argue your point of why maybe focus or funding needs to be spent in these areas. It can be a really quick, impactful snapshot of how things stand in your state. I would also say by looking at other states and seeing maybe if they have an area with a higher grade, or you have colleagues that are in a state with a certain area that has a higher grade, it might be a learning opportunity to pull out success stories and strategies that got them to that point, that can be lessons learned. The other piece I will note with that is part of this virtual tour that we are doing. We are pulling together the conversations and the feedback that we have gotten from each state. We often hear from folks on these calls, what are the success stories that folks are doing? We will share some legislative ones. but we are pulling together those conversations and commentary into a summary report. So we will have a summary from every state that has done this seminar to look at those success stories and understand some of those paths forward. I'm going to pause for a second and see if there are any questions or comments before we keep going. Okay. Sheila, I know you'll let me know if there's pieces in the chat. Okay, great. Okay. I mentioned before that there is a way to kind of quickly look at a snapshot of each state and their numbers, and this is a screenshot of how to do that. So this dashboard allows you to quickly gain those insights on key indicators. So if you hover over the states, you can look at the oral health status of veterans in those states, and that might give you further insight in a quick full scan manner of which profiles to pull up and go more in depth into. Okay. So I would love to hear from you. You can put it in the chat. You are welcome to come off mute and share. Is there a barrier that isn't in the data we just talked about, but you know is real for veterans in your community? Something that you see reflected in your work that's not reflected in the data?
I think a lot of the barriers that we are observing here in Mississippi, you all have covered very well. So I definitely appreciate that.
Okay. So I'm hearing what you're seeing is mirrored in these data. Okay.
Mm-hmm.
Seeing coordination of care. I'm going to pull this over for a second. Coordination of care between dental and medical providers is also a challenge, and building trust. I'm seeing that trust piece come up a lot. And if folks have ideas for that, I would love to hear that. If they have more information they want to provide on that, I assume that that's between trust of the veterans and where they're getting care, or that the care is going to be reliable. Collaborative care and referral programs.
Hello, everyone.
Hello.
Hey, I am Lakeisha Parker, and I'm with the solution or organization with Canopy Children Solutions. And I have partnered, or our organization has partnered with Boots to Beyond, and they're from a small town in Leland, Mississippi, where they create a platform to assist the veterans. And we're actually having an event October the 31st in our Washington County area at the Washington County Convention Center in Greenville, Mississippi, where all organizations, partners within the communities are going to come together to make sure that the veterans have the resources that they need. The person who funded or found this organization is Mr. Kenneth from Leland. And I think it's a beautiful thing. And I know I wasn't aware of all the resources that veterans didn't have. So it's a beautiful thing to partner with him. I think his last name is McGee, to partner with him to provide those resources for the veterans in our state. So if any of you are not aware of that organization or that foundation, I think it's a beautiful thing. I can provide some information to you all, but and if you're in the area or know of the event that I'm speaking of, can't wait to see you all on October the 31st.
That's great. Thank you so much for sharing that. And that's a great point of why we asked folks to make sure they connect in the chat. If you're willing to share those links and info dates in the chat, that would be great. And or you can email them to us. Sheila can grab those and email them back out when we do our follow-up email, and we can post it in the Academy as well. I see waitlist is another barrier. And I think I saw kind of the reliability times for appointments, waitlist. I see that occurring a lot in the feedback that we're hearing. And, you know, something that comes up a lot, this is kind of stepping away a little bit for a second, but I'm not sure if any of you are familiar with Open, but we were able to participate. It's or Oral Health Progress Equity Network did a Hill Day for oral health equity this past spring, and we were the veteran community voice for that piece. We pulled in the veteran issues that were part of the asks that we were making during that Hill Day. Part of that conversation was looking at the community care network and understanding how we can strengthen that or make that easier. And for those of you who are unfamiliar, the community care network can be a way for folks who have eligibility and are able to get appointments. If they can't get, if the wait list is unreasonable, if the time to an appointment is a long time, if they can have referral out into the community care network. A lot of problems we see there is there's a lot of red tape for those providers who are providing care in the community care network. And as well as there's a lot of burden on the folks on the VA side providing those referrals and doing a lot of paperwork pieces. So there's, I think, some administrative versus legislative things that can be done if we advocate and raise our voice for those systems to alleviate some of those wait list and appointment time pieces. Not actually having a dentist in some small town or areas, so workforce issues for sure. Okay. Again, thank you everyone for participating and providing their thoughts and pieces here. Okay. So we're going to talk a little bit about, we talked about that data. And again, we didn't want to just have a didactic presentation without paths forward. And we, again, developed these profiles really with the hope that they were a useful tool for folks to employ change and work for change and at their local level. So we're going to talk about that a little bit more and how to use these profiles, using the data to illustrate the need, sharing the profile to start conversations, and taking access and elevating success stories. So one of the most powerful things we can do with this data is to advocate, and that can look different depending on your role. So again, when we have dental public health, I think probably there's a lot of roles represented across the attendance here today. But whether you're a provider, a policymaker, or a veteran yourself, there's a lot of different pieces you can do. So this profile gives you credible local data to bring to, maybe it's your city council, maybe it's your staff, maybe it's another coalition meeting. You could do something like organize a listening session in your community and invite decision makers to hear from veterans. And
I love
let me. Okay, I wasn't sure if we had a question or if that was a tech piece. Okay. And just noting here that small advocacy pieces, like having a conversation with a colleague, making a call to your local official, it might seem small in the grand scheme of things, but they really have a ripple outward effect in a big way. So again, hitting on the point that many people working in healthcare, I think I saw this reflected in the chat here, that understanding piece, right? Many people working in healthcare or veteran services don't know how stark the oral health gap is. I think I saw that, you know, when we think oral health literacy, we think of the patients themselves, but there's another piece to that, right? And that's where that education piece comes in. So you could, again, use this profile to lead a short talk for your organization staff meeting. Maybe it's briefing another partner. We find that when stakeholders are informed, they become allies, and that's how we build momentum. This is also an opportunity where we can collaborate across silos. In public health, we talk about non-traditional partners a lot. Maybe you're bringing this to someone in housing or transportation or mental health or food access, and you're finding a new way to align your efforts to approach this issue. Shayla, is there something in the chat?
I just wanted to add, Darren stated that stigma or pride often keeps veterans from asking for help until problems become severe, which I thought was a great point, and just wanted to capture that.
Yeah. Yeah. And I think that ties back to that education piece and having the conversation. Maybe if more providers, especially that medical dental integration piece, understand asking if dental care is happening, asking if dental care appointments are happening, or if there's pain, maybe we can provide a pathway for seeking help before it gets to that point. Thank you. Thank you, Darren, and thank you, Shayla. Okay. Informing strategic decisions. So again, this data is, as a tool, we're hoping will allow you to inform strategic thinking, whether you're leading a nonprofit, managing a health program, advising on policy. You can use the profile to help you decide where to focus. And that might be a literal where. So you might be taking that map and thinking through those counties, and it's a geographical where. Or maybe it's an issue area where, looking at that report card piece and picking one of those issues as a starting point. It's also hopefully helps you make the case for why you're investing resources where you are, or why you're trying to garner the resources to approach this. Okay. So to that end, I don't want to talk about how you could use this profile to bring in resources. So grant makers and funders, they want to see data and they want to see it grounded in the community. And our hope is that this profile gives you that so you can have those conversations and seek those resources. So you could use it as a problem statement of your grant. You can use it to show gaps in care. You can also cite it as a foundation of what your solution will address and as a benchmark if you're measuring outcomes and deliverables of a program you're proposing. Okay, I'm looking at the time and I'm going to pop over to this poll. So again, if folks can go back to Slido, we want to be leveraging our data and our research to best serve you. I mentioned this several times. So we want to hear from you about what additional tools would be most helpful in your work. So again, if you closed out, you can just scan this QR code or go to the website here and take a look at this poll. Educational materials. I'm really hearing that with the oral health literacy piece. Training modules. Research findings. And also, Dr. Johnson, I'd love to hear, as you can imagine, every coalition that we have the privilege of working with across the country is very different. They're different in their structure, they're different in their focus areas. I'm wondering about the coalition and if you have, are there educational materials in existence that could be repurposed? Is the coalition positioned to maybe tackle some of these oral health literacy needs?
Of course, we do definitely have resources and avenues that we can pull educational pamphlets, educational materials, educational resources, and disseminate those to those individuals who need them. If they just can contact us and let us know when and where, we are definitely there. We have done plenty of things in the past, several different health fairs and other collaborative efforts to try to disseminate that information into the community.
That's really fantastic. Okay. Educational materials, definitely by far our leader here, training modules and research findings. Okay. Fantastic. Okay. We also mentioned that we were going to talk about some policy advocacy spotlights and some success stories in other states. And I'm clicking on my notes and not pulling you back to the slide, so I apologize. Okay, so first we're going to talk about Florida. Florida passed some legislation that was fairly recent. This just began being enacted and implemented, I think, early spring of this year. So the legislation created the Veterans Dental Care Grant Program within the Florida Department of Veterans Affairs. So that program was designed to provide dental care to veterans. The department partners with a statewide direct support organization to administer the program, and then that organization distributes grants to nonprofits that have a strong track record of serving veterans. So those nonprofits deliver care to eligible veterans based on income, service history, and other qualifying criteria. So again, that was fairly new legislation. It just started being implemented in the spring. So this was kind of our call to keep an eye on Florida and how this was going. I think we just recently heard that it has been successful thus far and they have gotten the mandate to continue the program. So calling that out to keep an eye on Florida, if you have colleagues in Florida and are interested in that as a legislative pathway, to kind of take a look at that and chat with them about that. Oregon developed an initiative or an innovative Medicaid carve-out specifically for veterans who don't qualify for VA dental benefits or traditional Medicaid. So veterans are first screened to determine if they qualify for either, and then if not, they're enrolled in a local coordinated care organization and receive free dental care through a network of community clinics participating in the program. We have Iowa on here, and Iowa uses state lottery dollars to fund their Veterans Trust Fund. And that fund provides direct grants to veterans to help cover out-of-pocket health expenses and some other things as well, but it includes dental care coverage. So again, we want to highlight these of 3 very different states with very different innovative approaches, but there are pathways that have proven successful to pursue at the local legislative level. We have Iowa on here because we've had the privilege of doing in-depth research and work, community-based work in Iowa for several years now. We were able to do a more in-depth research report along with strategic recommendations, and are now working with their coalition to put together a veteran committee and really provide technical assistance and capacity to get that committee up and running and help them follow up the strategic plan that we developed for them based on their stakeholder feedback. Working again directly with the coalition members and the oral health and veteran stakeholders in their state to develop a plan and giving them the scaffolding to start implementing their plan at their state and strengthen their veteran oral health initiatives. Okay. So I'm going to pause for a second here and see if there are questions I can answer for folks. Well, I will ask a question if that is okay. Were folks surprised by the data for your state, and or did you learn something new about veteran oral health, either nationally or in your state in this session? And you're welcome to put it in the chat as well if you can't come off mute. Okay, Norma, you were surprised. Okay, and I see Lenadra, you love the success stories. Okay, not surprised. Anyone else? Any other questions? They also do not have to be for me. It can be you're a Mississippian, nothing surprises you. If you heard from one of your colleagues in the chat on the feedback and you want to hear more about work that your colleagues are doing, I also invite you to ask that and for folks to share about the work that they're doing. It does not have to be a question for me. You are not surprised about the data. Okay. Well, I will say I'm going to pull up our slides again and talk about next steps. But if something occurs to you with a question, please. Okay, good question about how can we get access to other state success stories. So a few ways. So the legislative success stories, those are on our slides. We will post those materials to the Academy afterwards. So I invite you to kind of look into those legislative pieces more. The Iowa piece specifically, if you go to vetdentaldata.org, we have a very large body of work on Iowa specifically. We did a year-long research project there. The initial report we published was, I think, 70 some odd pages long. We have a summary of every community forum and community stakeholder engagement piece that we did, as well as we published a strategic plan for them, and we are about to publish an advocacy toolkit for them. So if you're interested in that work, and that also kind of some strategic recommendations might be lessons learned that other states can apply, but also what it looks like when a state comes together and a coalition comes together and does deeper work and research on veteran oral health, that is all on vetdentaldata.org. The other piece is we have not yet published our summary report. but we are about to. I would say probably in about the next month or so. So keep an eye out for that. We can also email out, and that has kind of those discussion pieces I mentioned. The other piece is that will be a living document, because our goal is to visit every state, and we are well over 50% there, but we have additional, these seminars are ongoing. So we will publish that to vetdentaldata.org, but we will continue to update it. Okay. Oh, Annalise, you are here. Okay. Tiffany, I'm just double tapping that you're saying it's scary because your daughter is in the Navy and one day will be a veteran. That's right. And I see a little shocked, but not surprised at the amount of veterans who do not qualify. Okay.
And I also noticed in the chat, one of the constituents was very astonished by the research of no dental care or very little dental care available for the veterans. So I just wanted to share that as well.
Yeah, thank you, Dr. Johnson. Okay. Um, Like I said, if something occurs to you, please put in that chat. Please feel free to reach out to us via email. We are always here and happy to discuss and provide support. I'm going to pull my slides back up to talk about our next steps. Okay. So again, at the beginning, we asked what brought you here, and many folks selected all four. Some folks selected learn. So I hope you are feeling like you learned something. I hope you are feeling activated. I also know it's a lot of information to take in. We're also all very busy. And I want to leave you with one very concrete, easy step to take after this session to keep momentum. And that's to share the state profile with one new person or organization. If you are willing, I invite you to put that in the chat, and share who you're going to share this with. That will help us keep each other engaged, encouraged, and accountable. So please feel free to share that in the chat. Next steps. CEUs are available for today's session. They are hosted on our Academy. Shayla is putting that link in our chat. When you go to that link, that is our page for all of our VRT seminars. As I mentioned, we've been to over probably about 50% of the states in our country, so you may see other sessions. Scroll down until you see Mississippi, and you can click on that, and it will be your evaluation and CEU request form. If you have any issues, please let us know. Once you complete that form, it will auto-populate and pop up your downloadable PDF for your CEU. Okay, I mentioned that our recordings and resources from today's session will be available on the Academy. Shayla will email those out once they're posted. If you have a colleague or a peer who registered and wasn't able to come, who you think would really benefit from this and maybe didn't register, please share out with them. The recording is available to watch asynchronously, and folks can actually still get a CEU through watching asynchronously as well. We shared some quotes from veterans earlier in this presentation. Raising veteran voices and stories is a key part of our advocacy work, and making sure we really make that human connection piece with the data that we're looking at and understanding the human impact of the data. As such, we are working to gather stories from veterans on their oral health stories. We have a form. If you yourself are a veteran or you know a veteran, we would so appreciate it if you're willing to share your story by completing that form or sharing that form out with the veteran you know. It is anonymous, and it again allows us to raise the veteran voice and stand behind our community. We said this very many times, but I'll just double tap on all of our research, and the resources that we talked about today are available on vetdentaldata.org. A few pieces to keep an eye out for. We have our LGBTQIA+ Oral Health Week coming up at the end of October. If your organization is interested in partnering with us, or you want to raise the activities around this week, please let us know. We'll have several resources posted. We also are about to publish out how to partner with us on our Veteran Oral Health Week, which will take place in November. So that information is forthcoming. If you are interested in participating or partnering with us on Veteran Oral Health Week, please reach out and email us, and we'll be happy to share out information. And we leave you with Veterans Deserve Equitable Oral Health. Okay. We're going to stop sharing and we're going to push pause on our recording.